Okay, good evening. My name is Colonel Jason Condrey, and I'm the U.S. Army Garrison Stuttgart Commander. First of all, I want to thank everyone that's already tuned in to allow me and some of our public health experts to provide you some information. I know there's been lots of questions throughout the community, and there's a lot of information out there, and want to try and use this as an opportunity to answer some of the questions you've already asked, answer some of the questions that will come in as a result of the responses to the information we provide, but ultimately create an opportunity to have a conversation, at least over this medium, and give a lasting record of some of the questions and the answers and how we proceed with the information that's available to us right now. I do want to start by saying thanks to the community members that provided questions. Have your a list of all those questions. We're going to try and answer as many of them right up front with some initial opening comments. And as you send in questions, we've got members of the team here that will pass those to us, and we will make sure that we try and get to all those questions. Right now, we've set aside 45 minutes for this live stream, but that doesn't mean that the question and answers ends at 45 minutes. So if there are questions that you have as a result of watching the live stream, or even seeing the Facebook information, the threads, the questions, the answers afterwards, we'll continue to update as you provide questions. So some initial introductions I have up here with me. Lieutenant Colonel Maria Bruton. She commands the Stuttgart Health Clinic here in our community. Next to me, I've got Colonel John Allison. He's the Chief of Preventative Medicine at MEDDAC Bavaria. To my right, I've got Joey Scaletta, who's the nurse consultant for infection prevention and control. And then to his right, Lieutenant Colonel Troy Baker, who's our public health emergency officer. And so they're gonna provide some initial comments, a public health update, and then I will go into some of the things that are specific to our garrison here in our community just outside the wire. So, John, well, thanks. Appreciate you being here.
Good evening, Stuttgart community. Once again, I'm Colonel John Allison, Chief of Preventive Medicine from Bavaria MEDDAC. And I just wanted to talk about what we know about the 2019 coronavirus, also known as COVID-19. As everybody I'm sure is aware, that the COVID-19 or the coronavirus is a member of a large family of viruses which include the common cold. And probably late in December, we do know that in Wuhan, China, we first discovered the virus. It was associated with a large live animal market. Since then, the virus has spread throughout the world. As of 5 March, there have been over 95,748 cases worldwide. In the US, 162 people have been diagnosed as having coronavirus. Here in Europe, in Italy, there have been over 3,089 cases. In Germany, which I think is of most concern to all of us, we've seen over 444 cases. And here specifically in Baden-Württemberg, there have been 80 cases that have been diagnosed. I'm now going to turn to Joey to talk about the symptoms and talk a little bit more about the coronavirus. Thank you.
So even though this is a new virus, we've learned a lot about what the clinical presentation looks like in humans from our partners in China and around the world where we're starting to see cases. So about 2 to 14 days after exposure, we would expect some individuals to develop symptoms. Now, the range of symptoms can be anything from no symptoms all the way to severe symptoms. We expect younger children, especially infants, to be asymptomatic. But even though that they're asymptomatic, they may still be shedding virus and able to transmit that virus to other people. Most of our age range, when we're looking from young adults all the way up to the mid-60s, we expect them to experience mild to moderate symptoms. The hallmark classic symptom of this illness is fever. 98% of individuals exposed to COVID-19 will experience a fever, and we're defining fever as 100.4 and above, and for those looking at Celsius, it's 38 degrees Celsius. 76% of patients will experience cough. 28% of those 76% will have some sort of productive cough, where you're actually coughing up phlegm and mucus. Another hallmark symptom of this illness is myalgia and fatigue. So you might feel achy and real tired. These are all symptoms of influenza as well as COVID-19. There are some other symptoms that have been proposed but happen in less than 10% of populations, and those include headaches and some GI symptoms like diarrhea. One thing that we do know is that these symptoms correlate with age. So the older that you get, the more likely you are to experience more symptoms or more severe symptoms. We know that especially in those adults over the age of 80 and those with underlying health conditions are more likely to exhibit some more severe symptoms that may require hospitalization. So what are we talking about when we talk about underlying health conditions? We're talking about things like diabetes mellitus, asthma, chronic obstructive pulmonary disease, or any immune modulating illness like rheumatoid arthritis, cancer treatment regimens, etc.
Do you want to talk about prevention, Joe?
Sure, let's talk about prevention. We're going to hear a lot about what the Garrison is doing to protect you, but there's lots of things that you can do as an individual to protect yourself and protect your loved ones. The first tip that I want to give you today is to avoid touching all of your mucous membranes, your eyes, your nose, your mouth. There have been studies done, and on average, American adults will touch their face and mucous membranes about 22 times an hour. So if you can stop doing that, you will decrease the likelihood of introduction of germs that you get from your pen or your surfaces into your system. So number one, avoid touching your mucous membranes, your eyes, your nose, your mouth. The other thing that you can do is try to avoid contact with sick people. What we know about this disease and the way that it's spread is that it's spread by droplets. And so think about when you cough or you sneeze, those droplets are going to come out of your mouth and travel through the air about 3 to 6 feet. So if you see someone that's symptomatic, you want to stay about 3 to 6 feet away from that person. We know that even if that person sneezes, it's going to come out of their mouth and then fall to the floor. And also don't lick the floor. We talked about that earlier today. Another thing that you can do to protect yourself and your community is stay home when you're sick. Don't feel like you have to be at work. We give you sick time so that you can recover and convalesce at home and keep your germs to yourself. The other thing that's super important is when you are sick, to cover your cough. Cover your cough with your elbow or sneeze into your sleeve and then wash your hands afterwards. We really want you when you're sick to clean and disinfect those high-touch surface areas in your homes more frequently. A lot of people will ask what type of product that I should use in my home to clean or disinfect. Any type of wipe that you could buy at the commissary or even on the German economy is going to have a disinfectant property in it. So look for something that says kills germs. And it's either going to be a bleach product or a quaternary ammonium compound. There's going to be something in that's going to disinfect, not only clean your surfaces in your house. The most important thing when you're using these products, though, is to look at the manufacturer's instructions for use. Read the directions and make sure that that surface area stays wet for the prescribed amount of time. If it does not stay wet, then you're not guaranteeing that you're actually killing the organisms that you're trying to kill. Another tip, CDC is at this time not recommending masks for the general public. So sometimes you'll go to a museum or an event and you'll see a bunch of people walking around with masks. Masks are really good for sick people to help keep their secretions to themselves, but there's no scientific evidence to suggest that that protects you as someone who's healthy in contact with sick people. So save the mask for the professionals that need them or the sick people that need them.
Okay, could we, Troy, if we could transition into what we have here from a medical capacity standpoint. What should people do if they think they're sick? What facilities do we have here on the installation, and how are we partnered with medical professionals just outside the installation?
So I'm Troy Baker. I'm a family medicine doc at the Patch Clinic, and also the FEO, the public health emergency officer here. So the question is, what do you do if you think you have the illness? So call us, let us know. Lots of ways you can do that. You can call in the clinic. You can contact us via Relay Health. We don't want, if you think you have it, we don't want you coming into the clinic though. Call us first, because what we don't want is we don't want people in the waiting room coughing on folks and then getting exposed and everyone else. We'll talk with you. We'll find out if you have an appropriate exposure. Right now, the appropriate exposures, you were in Italy and you have symptoms. The symptom either being a fever or you have and then a cough. Also, if you're in the other countries such as China and Iran, that matters as well. And so once we've identified you as a person, once you've identified as a person who needs to be tested, we will bring you in and we'll have you contact us, because we don't want you to come in. So we'll bring you to our special room that we have set up for it, and we'll test you for flu first. If you're positive for flu, we'll treat you for that. If you're negative for flu, we can either test you there, or rather draw the sample there, or we can have you done at the local, send you over to the local hospital and they can test you. We do have testing capability at Patch Clinic right now. We can draw the sample, but then we have to send it up to launch stool, and launch stool will then test it. It takes about 3 to 5 days for that to happen, for us to get the testing result back, and in that time you'll be expected to self-quarantine yourself and isolate. And really the treatment for it comes down to isolation, unless you're not doing well, and then we'll move over to hospitalization. And for the most part, it's really just keep yourself really, really well hydrated, and then use like non-steroidals like Motrin.
We're just going to move closer, just having some issues with people hearing you guys, so we're just going to move to that. So.
Okay, so Troy, you hit a lot of things there, and I know some of the questions that immediately come back from it. You talked about how we're doing testing. You talked about the process. If you think you may be sick, who do you call? That leads to a natural question that some in the community, some of you out there have already asked, is how many people have been tested for the coronavirus? And so thus far, we have had 2 members of our military community here in Stuttgart get tested for the virus. One, we've already got the results back, and that test was negative. So that individual is still recovering from symptoms, but not positive for coronavirus. The other is another individual at home, still waiting for test results, and hope to have that information here soon. But thus far, only 2 cases that we have not been able to eliminate other causes of illness, and have led us to do testing for the coronavirus. There is a question as to not only what do we have here within inside the community, but what is happening outside the community. So there's already a hospital identified to do testing and provide results. And yesterday, one of the counties, Boblingen County, added a testing facility in Herrenberg, and I anticipate that there will be additional counties and additional capabilities that are provided outside of the installation, above and beyond our ability to test here at Patch Clinic, and of course send to launch stool to get the results.
I have a question here. This is Colonel Allison, and it says, for the wider audience, will you please dispel the myth that this is no worse than the seasonal flu? So, yes, we have a new virus. And since it's a new virus, our immune system, our body's defenses really don't have the defenses to counteract that virus. So the normal seasonal flu, first of all, we have a vaccination. So the first recommendation for anybody who is out there who has not been vaccinated against the flu, become vaccinated, because that vaccine provides protection. So the normal seasonal flu, basically, pretty much all of us have some immunity to that, because our bodies see it year in and year out. This is a new virus. So the difference here is our defenses, our immune system, basically does not have the defense to be able to fight against it. And that's why we see that people who do come in contact with the coronavirus, that in general will become sick, but in most people, like Joey has stated, pretty much they will have symptoms like the common flu. Only in those individuals who are older, obviously, or who have underlying medical conditions, potentially may become sick and have to be hospitalized or have more serious illness.
I want to take this opportunity to talk about some of the guidance and what will drive decisions within the garrison and within the community as to how we respond to the virus, especially as conditions, as we see in the news, continue to change day in and day out. And so, first of all, within the garrison, we are following the guidance that has come from the CDC through the Office of the Secretary of Defense, Department of Defense, down through all the different services, and we are implementing that guidance with respect to how we will respond from additional hygiene measures to the day-to-day interactions, travel, all of those things that, as part of our duties day in and day out here in this military community, we need to be aware and how we might need to adjust our activities based upon what's happening with the virus. So specifically, the increased hygiene measures that Joey mentioned, we are implementing at all of our facilities. All of those actions used to wipe down surfaces and keep them clean, it's happening. Our duty buses, the drivers are wiping down the seats every day. At our MWR facilities, we are cleaning those spaces over and over again, wiping the counters, wiping the things that people touch, both as members of the community come in and use those services, but on the same side for our workforce as well. For child and youth services, we've increased the amount of cleaning. We've also increased the number of times we have the children that are there wash their hands. So as soon as they arrive, they wash their hands. As soon as they are about to eat, they wash their hands. As soon as they're seen sneezing, they get to go wash their hands. So all the things that you hope is happening at the CDCs that you would do with your child, that's what our staff is doing. The fitness centers, we're wiping down equipment almost constantly. That's what you see the staff doing. They're not at the desk because they're out walking through the facility and wiping down. And I know the patrons are wiping down equipment before and after, and appreciate that and ask that you continue to do that. Our hotels, they have always cleaned with hospitality grade cleaning agents, replace linens, and so we will continue to do that, and I assure you the cleaning staff is doing an extra wipe down just to make sure that the rooms that we live in over there in the hotels are what you expect them to be and what you would have as the standard in your own home. Their day of school, so talked at length with principals and the superintendent, and again, just as we talked about CDSs or CDCs and child and youth services, as soon as kids arrive at school, they wash their hands. Before they go to the next classroom, they wash their hands. Before they eat, they wash their hands. I've asked my own kids, what are you doing differently now with respect to the virus? And they're telling me that they wash their hands 100 times a day. I'm not sure it's that many, but it's a significant increase for my family. And so all of those measures are in place. And that is in line with the guidance that we are seeing from the CDC. It's also in line with the guidance that our German partners outside the wire are getting from their medical think tanks and their Ministry of Health and Education. So at this time, we don't have any cases of the coronavirus inside the community. So based upon that, we're going to pace our actions as a garrison on what's happening in our community just outside the wire. So specifically, right now, our German partners have not issued any delays for schools, for kindergartens, or daycare. They have not implemented any additional measures for public transportation. They have begun to cancel some large events. That's based upon guidance that gave down at the lowest levels community city commune leadership the ability to make decisions for gatherings of 50 or more people as to whether or not they want to continue those gatherings. So depending on where you live in the community, you may see something that's different than your neighbor 5 kilometers away that falls within a different district, a different city, within a different boundary. That's the status today. The reality is that could change for this community tomorrow and the community next door 3 days or a week from now. We are linked in very closely with all of our partners, our mayors, our city councils, our district councils, outside the wire, the Ministry of Health, all the way up to the region level. And as things change for them, they are sharing that information with us, and we will share that information with you. We're going to continue to use Facebook and the Stuttgart Citizen as the place where we will post the information that we know to be true at the time we post it. I understand that things will change, and our community has been fantastic about crowdsourcing information, asking questions, and I ask you to do that. Hold us to task. We will continue to look at those and try and find as much information as possible. Any questions that you've got that you'd like to answer?
Yes, this is Dr. Allison. We had a number of questions from Facebook, and some of the questions we're getting now, so I'm just going to sort of tie them in together. So a number of people on Facebook wanted to ask about the COVID-19 testing capabilities, and I know that Colonel Baker talked about that, but I'm going to sort of respond to that. So one of the questions was, why do test results for military take longer than the public, the host nation? Number one, the tests that we do are run at Landstuhl Regional Medical Center, so we have to send them there, and generally it will take a little longer than going down to your local clinic or the hospital and getting those tests run. So that's why it takes a little bit longer. It has to be transferred to Landstuhl. We don't have the local capabilities to run those tests. Landstuhl does. And the difference, and then the other question is, why can't we send our test to a local hospital? So one of the things is we fall as the DOD under CDC FDA guidance. So basically, the tests that we run in here on post, whether it be, are basically fall into the same testing capabilities as in the United States, and Landstuhl has those testing capabilities. So sometimes doctors may decide to send somebody to a local physician or send somebody to the emergency. If they're sick, send them to the emergency room, and those tests will be run there.
Can I caveat on that?
Yes.
Okay, so one of the other questions was, if a patient comes to our facility and the provider in our facility thinks that the patient is ill enough and needs to be evaluated at a higher level of care, we may, via our patient liaisons, coordinate for that patient to present to another hospital. A lot of hospitals are setting up tent areas outside of their hospital where they are screening patients, and then your test swab would go to the local public health department, and then your results would come from the German local public health department. One of the other questions here was, can people with trachea get tested off post? Yes. So if it's after hours and you have symptoms and you've traveled to any of the areas of concern and you have fever, you can call our appointment line directly, and one of the options is to reach the nurse advice line. If you contact the nurse advice line and they triage you and they say, we really think that you could be what we're calling a patient under investigation based on the symptoms that you're having, they may recommend that you go to the local ER. If they make that recommendation, then you need to call our patient liaisons. You can reach them through the MP number that's on the USAG Stuttgart app. The patient liaisons will call you back. You let them know that you had a conversation with the nurse advice line and they recommend that you be seen based on your symptoms, and they will coordinate that care for you so that you are not showing up to a local emergency department and sitting in that local emergency department potentially infecting others. So we would like to make sure that that's a coordinated effort, and so that it's easier for you too, and you're not just showing up and not sure what to do. The patient liaisons can guide you through that. And then those patients that are evaluated in that off-post facility would be tested using the local host nation testing equipment, and it would go to the local public health department, and that's how you would be contacted with results. Okay. The other question was, are DoD civilians authorized to come to Patch Clinic? So if you have traveled to any of these areas and you think that you are a patient, could be a patient under investigation, you can call our call center and we can help you walk through that. If it's during the duty day, our nurses are triaging some of those calls and they can help direct care. And if you need to be seen also in a civilian facility, then our patient liaisons can assist you with that too. Okay?
Thanks, Maria. So I've got a question here from Megan, and it's not focused necessarily on testing, but focused on decisions related to exercises with other countries that cause our service members here to travel elsewhere. And the question is, are we assessing those, especially when we're interacting with other nations for their necessity? And the short answer is yes. Every organization that has planned training and exercises, and there's very little that we do that doesn't involve other nations here on the European continent, they are assessing whether or not that exercise needs to be performed the way it is, whether that bringing all of those people together is necessary in order to meet some of the mission requirements. So thus far, we'll continue to let units make the decisions. I know unit leadership is focused on those kind of questions specifically. Closely linked to that is official travel in general. As you look across our community, you've got every service represented and most executive agencies across the executive branch in some way, shape, or form are established here on the installation. And so there's guidance coming down through all of those channels, of course originating from CDC guidance, that describes exactly who is the approval level for travel based upon a specific location. And so if there are questions related to, do I need to travel here, those questions are going to need to go back up through unit chains of command to verify if that travel is still planned.
Okay, I have a question here. Kids with asthma, any additional measures? From Cheryl. So kids with, or anyone really with asthma, they can be triggered from a cough or a cold or the flu or coronavirus. So not only is the coronavirus an issue, but they could also trigger them into an asthma attack at that point. So yes, there is additional things for the patients with asthma. Just have a lower threshold for coming in to see the physician, coming in to see the clinic. Also be a little bit more careful. We're all careful, but just be a little more careful. If you think someone's sick or you think someone's ill, if you're debating whether or not to go to the party or go over to someone's house, just skip it. Just be a little bit more careful. And that goes for anybody really with any immune issues going on. So if you have COPD, if you have diabetes, if you have any other thing that would make things a little bit more severe or could then kind of think twice about it and protect yourself and your family a little bit more.
Any other questions? So I have a question here. These came from Facebook last night. It was, again, focused on what's happening in our schools. And so we talked about hand sanitizer or Lysol wipes, or what are the measures that are happening within our classrooms. Again, the desks are being cleaned each day. Kids are washing their hands. That's the primary focus. And we'll continue to do that until there's a decision to change the practices based upon some of the public health guidance that we get. A closely linked question is, what happens if we close the schools? So I can tell you that our superintendent, our principals have already been discussing the plans associated with, should we need to close schools, what exactly are we going to do? And so they've already learned from some of the other garrisons that have closed schools and are dealing with this now, taking some of those lessons and specifically preparing for that eventuality. If there's a decision, there will be probably a small period where we look to develop lesson plans that allow our teachers to interact with students via the internet, via a Google website, and so already putting in place the measures that allow that to happen. And the intent is that is a low bandwidth, something that you can do from a computer, something that you can do from a smartphone, and depending on how long school is out, there will be deliberate efforts to get the instruction to our kids and have interactions with teachers to create the opportunity for them to ask questions and get some additional instruction, especially if the material is giving them problems. So that's in place. Another question there is, hey, if we don't have computers, what are we going to do? So our schools do have a set of computers, Google Chromebooks, and they have the ability to issue those out. It will probably be one to a family, unless there is a unique circumstance that would drive additional computers to be issued. So right now, you know, our schools, our teachers, they're preparing for this. They're having the opportunity to discuss with their peers that are dealing with this elsewhere and learn some of the lessons to help them step into this rather rapidly.
So here's another one from Facebook.
Okay, so here's a question from Michelle. Can the front gate guards not touch ID cards? So what is the concern with ID cards specifically?
I guess the concern might be that obviously that somebody could transfer virus onto the ID cards. I don't know what that I'm sure that we need to study that and see. I know that probably in Korea they've probably implemented some processes that I would think that we need to look at here and see about how we would deal with that here and try to take the lessons learned from places like Korea and implement them here. We haven't reached that point yet, but that is something that we need to study and look at.
And Michelle, I'll add on to that because there's two sides to that question. There's the security aspect of some threat to our community taking advantage of the fact that a security guard doesn't physically touch and confirm that an ID card is a valid ID card. And contrast that against the risk that you potentially could transmit the virus by that exchange of an ID card as we come in the gates. So I know there are instances at other installations where they have put that measure into place. What is yet to be determined is whether or not that is proven to be an effective means of preventing the disease from spreading. And so, you know, we will continue to look at those kinds of questions and see if there is a good way to implement some of those things that we are seeing elsewhere. So this question is, what will be done about the lack of cleansing material? So I've talked to both the managers for DECA, the commissary, and APs here within the community. Items have been ordered. Understand that there has been an increased demand, and as a result, we have put some limits on the number of things that the community can buy as they go in. Because even if you didn't come into the PX to get hand sanitizer, the fact that you saw a sign that said you can only have 3 would probably prompt you to pick up 3. So, you know, we're mindful of the fact that the scarcity of it is driving people to stock up on items, and that of course is making the demand on those items and our availability even more problematic. So short answer is items are already on order. They are inbound, and as soon as they arrive, they'll be up on the shelves, and we will put them out there to ensure that the community can buy them. I'll go back to the fact that we have plenty of soap, we have plenty of bleach, and those are the things that are, if you wash hands and use bleach to clean surfaces, those are the things that are having the biggest impact on the prevention of this disease.
Is there a question from Facebook?
Okay, so this question from Mateus is, will the spring bazaar be canceled? So we've got a couple big events happening across the community, and I will characterize big events just as our German partners outside the wire are characterizing them. So anytime we're going to bring 50 or more people together, then we are looking at that event, and we are looking at whether or not we need to cancel that event every day. And so right now, we have not canceled the spring bazaar. If we've implemented some additional screening for all of our vendors that are coming from outside of the town, again, my assumption is that is that we need to be concerned about the virus coming from outside into the installation. So we will do that screening, and we will do our best to implement additional sanitation measures, just as you've seen, in the CDCs, in our schools, at all of our service areas, the food courts. Those will continue to occur as part of the spring bazaar. If the virus creates the conditions where we need to cancel the bazaar, then we will cancel the bazaar. So I know that this is an important event to the community. There's lots of interest each and every year, and we will continue to make sure that the health guidance and the conditions that we are seeing both on the installation and off the installation are what drives that decision.
So there's another question from Facebook. So no one answers the phones at the clinic. What are the best numbers? So the Stuttgart clinic, we have a central call system out of VLSEC, and so that central call center services 5 clinics. And so that's why there's sometimes a longer wait when people call in. One way that you can reach your provider care team is to use your secure messaging Relay Health account and secure message your provider team. But we can also try to look at ways internally that we can reach our patient, or that our patients can reach us without having to call the call center. So I know that is a bone of contention, but know that we share. We're not the only ones. We don't have a call center for the Stuttgart clinic alone. We are sharing call center staff with 4 other clinics.
Okay, I've got a question here. This question came from Kathy, and it's, will travel of any kind be restricted? And so, Kathy, the short answer is it depends. And depending on what happens over the next couple days, weeks, in reality, we don't know how long we're going to be dealing with the virus. I don't know if it'll peak, how high it'll peak. I don't know how much it'll affect, our community, the Stuttgart community, how much it'll affect Germany. Those are things that will be taken into consideration when it comes time to make a decision about travel. Whether we're talking about official travel, whether we're talking about recommendations that the garrison and public health officials will put out there regarding leisure travel. Because I know spring break is coming up. There's a lot of families out there that are concerned about, hey, are my plans still on, my plans off? I know my family, we have plans as well, and are waiting to see how this shakes out with respect to whether or not the place that we want to go is a place that we should go. And then at the same time, are we exposing ourselves unnecessarily to a risk? And so, again, that is information that continues to change every day. And as we get more information, we'll continue to provide it to the community. A second question, any special procedures for incoming families? So I will tell you that for incoming Army personnel, and I presume that it is the same for all the other services represented here on the installation, that we are tracking by family who is inbound, number 1, to Germany, but number 2, from any of the affected regions. And right now there are not any halts on PCS, even if you're coming from Korea or coming from Italy. That may change. Again, this continues to evolve, and as it does, and if the risk requires, then there may be modifications to that. But currently, there are no limitations on PCS. Any questions?
Kevin asked, are there any plans to identify barracks for lodging for quarantine of personnel? So yes, we've identified a location that we can do that. The mainstay of our strategy is by disease and isolate. And for the most part, that is going to be in your own home. We want you to, if someone in your family ends up with coronavirus, they should be isolated in their own room. Try not to leave that. If they go out to go to the bathroom or use the kitchen, do your best to keep that clean. But for the most part, it's going to be isolate within your own facility. But we do have, for those who don't have their own place to stay, we have identified a place for that, and we'll try to scale up from there if we need to for other things.
Sure. So we have another question here from the stream. So does hand sanitizer kill COVID-19? It actually does. So COVID-19 is actually an enveloped virus. So the virus particles have a protective sheath around it. alcohol will act on that protective sheath. When you don't have hand sanitizer, because I know that the commissary's out, hand washing, that physical removal of the organism from your hands and flushing it down the drain is just as effective.
Any other questions? So this question is, will the garrison post confirm recovered and deceased data for Baden-Württemberg? And so that question is, first of all, we're linked in with our partners outside the wire. We're continuing to use official sources and quoting them and linking to them. The social ministry is our #1 source, and they are linked directly with the Robert Koch Institute in Berlin. And so we're going to continue to use that source, from a German perspective, from a state of Baden-Württemberg perspective, as the official source. It has been ahead of most of the German media and continues to be updating as information changes. And so we will provide the link to that site on Facebook, and so that the same things that we're looking at, the community as a whole can look at as well. Can family from the U.S. in the next week or 10 days arrive? So the question that just came in is if we're expecting family, and I would put myself in that category. My parents are expected to come in next week. Can they still arrive? The short answer is yes. We are not going to prevent any sponsored guests onto the installation at this time. When it comes to where they're traveling from, there may be some other things that may impact that travel. I know lots of flights are being canceled, and in some cases being canceled without warning. And the concern may be that if family does travel here, will they be able to travel back home? And so that is a consideration that I will offer for anyone that has in-laws coming, or any other family members. Any other questions? Handshakes, greetings, and official events is this address. So we're obviously conditioned to shake hands, give hugs, and so yes, the guidance is to minimize that, that contact and that transfer. We've done our best to implement fist bumps, elbow bumps, a curt head nod, something that keeps you out of that 3 to 6 foot range that Joey here mentioned, keeps you safe from the little, what did you describe them as, the little balls of moisture? I don't know that that's what you said. That's what I heard.
Droplets.
Droplets, thank you. Okay, so one last question. So what will happen if you guys lock down the base? So that's a great question to try and wrap up with. So I come back to the fact that this installation here, and the people on it are here for a reason. The headquarters on this installation are currently doing plans as to how they continue operations. Should we shut down schools? Should we shut down childcare? Because that will have an impact on the available workforce that's able to come in and day out. And so those plans are going on with our mission partners across the installation, and the garrison is tied in very closely with them to ensure that what we do doesn't inadvertently prevent them from accomplishing their mission. That even though it's focused across two continents, it's also being affected by this virus because it's affecting countries across the globe. And so if we lock down the base, first of all, the base will always be open to our community members. We may not have services open, but the reality is if there's somebody off the installation that needs to come on the installation, the gate will be open. There may be additional screening criteria that go into place. We're planning for those possibilities, but right now, again, the guidance does not require that. So we will continue to update the community. We'll do it daily. We'll continue to try and provide the most recent information that we're getting from our partners outside in the German communities where much of our community lives, day in and day out. And so the video that you watched, it'll be available on Facebook. The questions that you ask, we will go back and answer every one of those questions. And as additional questions come in, either as a result of our answers or something that happens within the community, please ask those questions. Please send a message. We'll make sure that we've got the expert that has the answer, that provides input. And I ask that as you see those questions that occur on neighborhood pages, please redirect people with those questions to this Facebook event, and so that we can get those questions answered by somebody that truly understands what is happening today and provide information should it change tomorrow. So I want to thank Colonel Bruton, Colonel Allison, Joey, and Colonel Baker for coming in tonight, being available to answer questions. I know they have a long drive back this evening, and so I truly appreciate your willingness to do this, and I'll offer you my thanks on behalf of this community. So with that, thank you. I appreciate those that tuned in, and again, if we haven't answered your question, please let us know, and we'll get it answered as soon as possible. Thanks, and have a good night.